All right, here's the truth. Most acupuncturists needle wherever the pain is, and that's exactly why results stall. The pain is the end of the problem, not the beginning. And when a patient shows you where it hurts, they're showing you a place where voltage has collapsed, not where the channel actually mainly failed. In this training, you're going to learn something that flips the whole pain treatment model. Treat upstream, fill the entire channel, and stop chasing symptoms. I'm going to show you how to diagnose the deficient channel instantly, how to choose early points like gallbladder 1 to fill the entire pathway, and how to run the treatment step by step so you get clean, predictable results. If you've ever wondered why some treatments last a long time while others don't, this is going to make everything clear. I'm Dr. Jeremy, and my mission is to help acupuncturists correct terrain collapse with precision and real physiology, not guesswork.
Category 1's tissues, Category 2's neural levels, Category 3 is acuchannels. And look here, patient comes in, they have this headache here. Well, you know that this muscle is on the gallbladder channel, or it could be simpler than that. You don't even have to think about muscles. So they come in with an occipital headache. Where's the pain? Touch the pain. And they put their finger right here. Bam. That's a deficiency. We started out the class saying pain is decrease in voltage. Bam. You now know the gallbladder channel is deficient. What do? Do you needle right here? No. You can, but the better result, remember we said the fascia is unidirectional. The channels are unidirectional. The numbering system lays out the direction of the energy flow. And when I say energy, I mean specifically electricity. And so if you choose right here, you may get some relief, but you're failing to charge all the gallbladder channel that's before this area here. Does that make sense? So you're better off, my favorite gallbladder point's right here. Bam. I love this point. It's at the end of the crease, easy to find. It's shallow to the surface. I needle it angled back. And now I'm filling up the entire gallbladder channel instead of just gallbladder, what's that, 20 and down. Does that make sense? So, Category 3, patient comes in, occipital headache, and they touch gallbladder channel. I'm going to choose gallbladder 1. Let's say they come in, they're like, I got pain here on tight traps and pain here, you know. Well, still gallbladder 1, because you're able to fill up the entire gallbladder channel. Let's say back to our sciatic example, they got pain radiating down here, the entire gallbladder channel. Am I going to needle directly into the gallbladder channel like gallbladder 34 where the pain is? You can. You'll probably get some relief, but that's more of a tissue point to compare and contrast. If you're choosing Category 3 acuchannel point, you want to choose a point that's early on the channel. You don't have to choose number 1, but for gallbladder channel, my favorite's number 1. But let's say you wanted to treat stomach channel. I don't like stomach 1. It's difficult. You can choose stomach 1 through 9, and that's still considered early on the channel. Yeah, Dr. Trish says early or late on the channel for fill-up. Yep. Alyssa says gallbladder 1's on the actual bone, correct? So I find gallbladder 1 by finding this crease. So see this crease here? In this picture, I would put gallbladder 1 here, and I'd angle it obliquely towards the lateral side of the face and just get it in there. The the skin is a high resistance. So a lot of times, all you need to do is bypass the electrical resistance of the skin so that the voltage electricity can fill up the deficiencies. The electricity goes to where there's areas of less resistance. Areas of less resistance are starving for chi. They're chi receivers until you fill them up. Until you fill the gallbladder channel up, if it's deficient, it will be a chi receiver, which you can think of as a chi stealer as well. But I think receiver's a more neutral, better term. Gabrielle says, so for occipital pain, when would you only needle gallbladder 1 and no other, and what voltage? Yeah, so if I'm using a higher voltage device like a Pointo Select or a Vasia, I would just choose one category 3 point. Let's say it's gallbladder 1 for occipital headache, and that's it for that category point. This protocol I'm showing you, you choose 4 points with a higher voltage device or choose 8 points with a lower voltage device. So did that answer that, Gabriella? And if not, we're getting to the specifics after we go over all the categories. And she says, yes, thanks. Kristen says, so you could needle gallbladder 1 for gallbladder 30 hip pain. Yes. Now you're getting it, Kristen. That gallbladder 30 hip pain was caused by a deficiency in the gallbladder channel, deficient of what? Electricity. And now you're filling up the entire gallbladder channel from gallbladder 1, including the channel going through gallbladder 30. Now, a little caveat, all the channels are labeled correctly except the Ren channel, which flows downward. So this is depicting flowing upward, right? From lower numbers to higher numbers, but the Ren channel actually flows downward. Alexander says, gallbladder 1 needling into skin over bone or going into muscle in the temple. I do it just under the skin. I do tend to bury a 1-inch needle here, but I do it superficially just under the skin because you don't need to needle into any muscle. If you remember, what's wrapping the muscle is the fascia, which is the most electrically conductive tissue of the body, remember? Okay. Patient comes in. I got hamstring pain. What's our category 3 choice for this patient? I don't know, bladder channel. Now, this is what I mean by treating other things. But if you just focus on this terrain pain protocol, you're going to be getting banging results, not only in pain, but also, for example, the mucous membranes that you didn't even think about or spend time diagnosing, because bladder channel feeds mucous membranes. How cool is that? This is what Georgetta was saying. It's so simple and exciting. You can just focus on a protocol and be getting banging results in other problems that the patient had. Maybe they didn't even tell you about because they didn't think acupuncture could fix it. But that's the beauty of terrain medicine. We're all connected. Parts of our body are connected.
All right, here's the truth. Most acupuncturists needle wherever the pain is, and that's exactly why results stall. The pain is the end of the problem, not the beginning. And when a patient shows you where it hurts, they're showing you a place where voltage has collapsed, not where the channel actually mainly failed. In this training, you're going to learn something that flips the whole pain treatment model. Treat upstream.